Hi, I am Dr. Lisa Koche, triple board certified functional medicine specialist, and today we're going to talk about alcohol and your hormones. So it turns out that even one glass can impact your stress, your biology, your hormones, and we have been fed a bunch of lies, which is a glass a day will make you, is good for your heart. So we've taken that and run with it. And unfortunately, in my patient population, in my decades of seeing patients, I've seen this one glass a day become 2 glasses, become, 2 or 3 every day, or 3 or 4 on the weekends. And now, and honestly, it got worse during COVID. It became a big coping mechanism. So let's talk about what happens so that you guys will approach that glass of wine with a little bit more knowledge. It turns out that alcohol does several things. The first one is it actually raises cortisol. This is counterintuitive. People feel stressed out. They want to run for that glass of alcohol. And even though it can make you feel like you're calming down, it actually impacts the very hormone that's wreaking the havoc to cause you stress in the first place. So it's a vicious cycle. It will affect your stress levels after that initial kind of calming period and cause poor sleep. We've all experienced that. When you drink more, you tend to have trouble sleeping. It also lowers, the sleep problem is because it also lowers your melatonin. So not only are you having maybe some trouble with sleep in general from the cortisol side of things, but you're also going to have trouble achieving those deeper REM levels, which make you feel restored in the morning. So bad combo, alcohol and sleep. Additionally, especially for women, this is pertinent to men, to guys as well, it alters your metabolism of estrogen. So for men, that means you're not gonna have as much testosterone. For women, it means that the estrogen can cause PMS that's worse, perimenopausal symptoms, menopausal symptoms, really screw up a very delicate hormonal cycle that should be going on in your body. And what's impacted, it doesn't just directly impact estrogen. It also shows, and we know this because it causes a liver burden, right? Everyone knows about that. That liver is required to, a highly functional liver is required to clear the alcohol. So what happens is it's loading up the liver in ways that it shouldn't. Many people have leaky gut already. So if you have leaky gut, remember you're not pooping the toxins out, then the liver has to work extra hard. Then you add in your glass of wine, right? That is calming, my healthy glass of wine, and you're causing a burden. The liver gets sidetracked. It can't deal with the toxins. It's got to go process the alcohol. So it's busy doing that, and guess what happens? Estrogenic compounds and your body's endogenous estrogen cannot be cleared. So there is a tie to estrogen-related problems, an increase in breast cancer, ovarian cysts, fibroadenomas, fibroids. Those are tied to alcohol. So really, if you are having that glass of wine, you want to rethink what it is doing to your hormones. Additionally, there can be what's called they've called it hangxiety, which is a funny kind of buzzword, but that hangover feeling combined with the cortisol. So you're going to get disrupted GABA, an issue with cortisol rebound from the alcohol. You can just feel both hungover, but also very anxious. So that feeling that's wanting you to grab more wine is actually from the wine. So breaking that cycle, and you can finally work through some of these symptoms. The sleep issues are huge and cumulative, and even moderate use had these effects. So that's the part that I think over the past 5 years, we've really understood more that 1 to 2 per week is really max that you should be having. So I'm not saying don't drink at all. I think having an occasional, it's enjoyable, you're socializing with friends, your body can handle it, especially if you have a nice, healthy, supported system. But it is going to tax your body, so do it for what it is. No, it's a luxury. I remember when I first learned about alcohol, I never really drank very much, to be honest, is because I heard that a glass of wine had the equivalent sugar as a piece of chocolate cake. So I've always kind of made my decisions because I always consider my vessel. So if I'm going to make a choice, am I going to have this or do I want a piece of chocolate cake? and it was always the chocolate cake for me. So that has its own set of problems, but I want you to at least understand that you are making a conscious choice when you decide if you're going to do this. It's not just, oh, I got to have my glass of wine today and I'll feel better. No, it is, okay, I am making a choice. This tastes good, it's sociable, it's going to likely disrupt my sleep, impact my liver, so what am I going to do to help that? And I've had other videos on how to help your liver when you do choose to drink. So my recommendations in general, if you are going to drink, try to stay away from it within 3 to 4 hours before bed. And unfortunately, many people drink right before bed, and then the sleep problems are worse. Always pair with protein and hydrating. So if you can have it with your meal, that's going to be better because it'll decrease the absorption rate. And keep yourself well hydrated because alcohol can dehydrate you. So make sure you're getting good structured water and you're having 3 to 4 hours before bed with your protein. There are now a lot of alcohol-free alternatives. I would recommend a 30-day reset where you just completely avoid alcohol. Do that to test yourself. Are you able to get off of it? What are the cravings? Where are they coming from? Ask yourself emotionally, what am I treating? What emotion am I treating with this alcohol? And see if you can find other ways to handle it. Soak in Epsom, get out in nature, talk to a tree. Those are some of my favorites. So do that 30-day reset. And then think about when you're in that 30-day reset, realize there are so many alcohol-free alternatives. So I did a clip with my friend who's a TV producer. We went and tried alcohol-free cocktails, mocktails they're called. They're delicious. So if you can order a mocktail and feel like you're part of the crew, side note, they can be full of sugar, so you got to find one that works for you. Maybe cucumber, mint, and tonic water or something. Those can make you feel like you're part of the crew. It feels like a little treat, and they have become more and more available. So remember, you don't have to quit forever. I'm not saying never, ever, ever. I'm saying make it a conscious choice. Make it mindful. Do it in these time frames that we talked about. Where possible, try a mocktail. Watch yourself. Feel better, sleep better, have more balanced hormones, and have a clear brain and better mood.